There's a new study out about Medicare for All, which absolutely destroys the pro industry talking points being used against a popular single payer program. Now, this was published on Saturday by a team of epidemiologists in the peer reviewed medical journal, The Lancet. Now, they found that Medicare for All will save Americans $450 billion dollars and prevent 68,000 unnecessary deaths a year. So now previously the number was about 45,000. Now with this new study, 68,000. That is amazing. So let me summarize the findings. According to the study, by replacing premiums, deductibles, co-payments, and out-of-pocket costs with a progressive tax system, Medicare for All saves the average family thousands of dollars each year and provides lower income households with the greatest relief. Now, it also helps hospitals, uh, especially in low income communities. Now, they would be helped by eliminating uncompensated care, which is a problem. And look, I reported on there's hospitals, I believe, in Kansas, although I'm not entirely sure. But there are these hospitals all over the country, by the way. And so you can't just point at one city or one town or one area. This is a widespread problem all over the country where people are too poor to pay for the medical services. Or they don't have, in a lot of places where Medicaid was not expanded, especially, you have people that go in for emergency care and then they can't afford to pay the doctors. Now, in some places, they have tried to solve this problem by suing poor people to try to get every cent that they can back from them for those medical costs, those expenses. So that has led, of course, unfortunately, to a reemergence of debtors' prisons, as a lot of these people, the reason that they can't pay in the first place is because they either didn't have insurance, because they couldn't afford insurance, or they were underinsured, or their insurance, what was left over when the insurance paid the bills, still was unaffordable. And so they couldn't manage this. And now they've had to go in some of these places into court. And if you don't go into court, well, you get held in contempt and then you get put in jail for basically what is being in contempt of court for not showing up to argue that you're poor. And so you're too poor for these bills. And so that strain right there is felt by these local hospitals. So they felt, again, that the only thing they can do is try to sue people, get them into court to pay these costs. If you eliminate the profit motive in private insurance and you replace it with a Medicare for All system where everyone is covered, you will no longer have that problem of uncompensated care. And so that completely eliminates that issue. And so that's important. Okay. Now, not only does it eliminate that, of course, it increases Medicaid reimbursement rates to Medicare levels, and actually also reduces administrative overhead, according to the study. And so, look, that's one of the one of the big things, right? Big problem with today's insurance is that big bureaucratic overhead. When you got to pay for executive bonuses, you got to pay for advertising rates, and all these different things, all these different administrative costs, which are not borne by Medicare. And Medicare actually it runs much, much leaner than our current insurance system. And so that would be a huge improvement. Now, that, of course, all that together leads to likely hundreds of billions of dollars in savings over our current system, which right now, this is a mind blowing number. Roughly $3.65 trillion a year. That's how much our current healthcare system costs, right? It is expected to grow by 2030 to $5 trillion a year. Now, one of the lies against Medicare for All is it's going to cost $32 trillion. Not at all correct. In fact, original estimates put it at about or a little bit less than the current $3.2 trillion that we already spend. This new study puts it at even lower, with us saving $450 billion. And so not only would it cost less, but it would also cover everyone, the millions of people without health insurance, and the millions more, tens of millions, hundreds of millions more that are underinsured. And so that's a problem. So now, just recently to add on to this, a breakdown by John Oliver ended with a ringing endorsement of single payer healthcare. Now, the study debunks several attacks on Medicare for all from the private health insurance industry that made lots and lots and lots of money. Now, for one, we just went over the cost. We talked about this. We talked about Joe Biden lying when he says, well, we just can't afford this healthcare. We can't afford the current system. And so here's the thing, though. We can't afford the current system. We can afford Medicare for all. And so Biden's saying, no, we can't afford Medicare for all, but we can afford the current system. That is a complete and utter lie. Not only that, but our current system still has 68,000 people who die from lack of health care. So please tell me what we can't and can't afford while all those people die. It's ridiculous. Now, you also have the talking point about choice. Well, you understand, if we keep our current system, then we actually have choice. And that's what Pete Buttigieg is all about, right? It's Medicare for all who want it, which is a public option system. Public option doesn't get rid of the faults in our healthcare system today, doesn't get rid of private insurance, doesn't get rid of the profiteering. It just adds a government option in which you still pay premiums, copays, and deductibles. That doesn't actually solve any of the problems, right? Oh, but no, choice, right? Under Medicare for all, you don't have choice. There's no choice. No. What's the problem with our healthcare system today is with all of our supposed choice, we still literally have no choice. In fact, what you have here are board members of insurance companies choosing whether or not the company will cover your medication. If it costs them too much, they will refuse to cover it. Or if your procedure costs too much, they will refuse to cover it, and you will fight with your insurance company. That's who gets the choice under our current system. You have corporate bean counters who are tasked to make as much profit as possible off of you and your premiums. Now, not only do you get more choice under Medicare for all, you can go to any doctor, any hospital, anywhere without having to worry about if you're in network or out of network, or if your doctor or if a doctor that happens to see you when you're in your network hospital happens to be out of network, you won't have to worry about that or worry about getting any sort of surprise billing because you won't get a bill at all. You're automatically covered. It is free at the point of service and paid for through taxes. Now, for employers, they went out. They're no longer on the hook for providing health insurance to employees. And so some of that money, even in the bill, especially since there's a carve-out for union benefits, will end up having to go back to the employee in either increased pay or increased wages. You also have a win for doctors, by the way, who will end up getting paid a little bit less. Doctors and hospitals would see large savings in cost and time, which again might actually lead to salaries for doctors staying relatively high. Not only that, but you also have doctors being able to spend more time with patients, actually doing their job instead of filling out paperwork and haggling with insurance companies. Now, you also have, and by the way, if you combine this with free college and debt cancellation, Medicare for all, then doctors who go to school at very, very large costs to themselves, by the way. And this is part of the reason why they can justify saying, hey, look, we got to keep our rates high because I can't afford my student loan payment and all that stuff. Well, guess what? Your loans are canceled, and any future doctor can now go and get, their medical license or degree at no cost at the point of service. Well, there you go. That will allow them to basically lower those rates to Medicare reimbursement rates, which makes sense. But look, here's the other thing, right? Between all the new studies that have found that guaranteeing universal health care through single payer would not only dramatically improve health and well-being of the American people, it will overall cost less than our current dysfunctional for-profit healthcare system. And the endorsements, add in those with the National Nurses United and the endorsement by John Oliver, who did a brilliant segment, who, by the way, his segments reach millions of people every week. It's looking like Medicare for All could finally start to be in reach if we have a Bernie Sanders victory. Obviously, a lot of work to do. There's a lot of fight to continue doing, but it's a start. As for Sanders, he lauded this study. He said the study confirms that Medicare for All will save the American people $450 billion on healthcare costs and will prevent 68,000 unnecessary deaths each and every year. In other words, guaranteeing healthcare as a human right by creating a Medicare for All system will cost substantially less than our current dysfunctional healthcare system. It will save working class families thousands of dollars, and it will prevent tens of thousands of Americans from dying each year. While the CEOs in the pharmaceutical and health insurance industry may not like it, we will end their greed and enact Medicare for All when I am president. This is, again, one of the many studies, 19 out of 22, the most recent studies, I believe, that show that Medicare for All saves money, saves lives, and is overall good. Now, if you want to have a conversation about how likely this is to pass, you got to get it through McConnell's desk, well, that's a different conversation, right? But you can't say that Medicare for All isn't the right policy for the right policy prescription for what we need as a country. And you also can't say it's not popular. Over 70% of Americans say that they support providing Medicare for All for Americans, according to a new American Barometer survey. The poll conducted by Hill TV and Harris X polling company also found that 42% of respondents strongly support the proposal, while 28% say that they somewhat support it. So obviously a lot stronger support than not. There's another Reuters Ipsos poll released back in August that also found that 70% of Americans support Medicare for All. There's no reason not to. This isn't pie in the sky. It's not unaffordable. It's not unworkable. The only thing missing is the political will in Washington. And that can and will be corrected by us, the people. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.